For today, I will demonstrate the proper execution of SITZ bath. First, let us know what is SITZ bath. SITZ bath is a warm, shallow bath that cleanses the perineum, which is the space between the rectum and vulva or scrotum. The purposes of this are to relieve itching, irritation, and minor pain, and also to provide faster healing. Next, the objectives of this are to relieve muscle spasm, to soften exudates, to hasten the suppuration process, to hasten healing, to reduce congestion, and provide comfort in the perineal area. So let's proceed for the procedure. First, we need to review the medical order for the application of SITZ bath, including frequency and length of time for the application. Practitioner's order is the legal record for the medication order for each facility. So let us check the medical order. Let's say that the length of time is 20 minutes, frequency thrice a day. So next, we will gather the necessary supplies and bring to the bedside stand or overbed table. This is to ensure proper procedure execution. So let's gather the supplies needed. And then, next we will assemble the equipments and materials needed. This is to save time, energy, and effort. Are the materials needed for the procedure. Here we have a bath towel, small towels, the gloves, the irrigation bag, the SITZ bathtub, and then thermometer, and also footstool, which is optional. After assembling the equipments needed, next we will introduce ourselves and verify our patient, explain to the patient what are we going to do, why it is necessary, and how the patient can cooperate to us. This is to guarantee that the right patient receives our intervention, and also for the patient to know and be aware about our procedure. So, good morning, ma'am. I am Mika Barnabe, your nurse assistant for today. Are you Mrs. Panginiban? Okay, ma'am. Today we will do a SITZ bath. This is to relieve you from pain, itching, or irritation. So, I hope you will cooperate with me, ma'am. Okay. Next, we will perform hand hygiene and observe other appropriate infection control procedure. This is to deter the spread of microorganisms. Ma'am, excuse me for a while. I'll just wash my hands. Okay, thank you. Ma'am, I'm done washing my hands. Next, we will provide privacy for the patient by drawing the curtains and closing the door. This is to maintain the patient's right to privacy and dignity. Ma'am, I'll just close the door. This will provide you privacy and lessen your discomfort. Next, we will put on gloves and assemble equipment at the bedside if using a bedside commode or in toilet. Personal protective equipments prevents close contact from body fluids and prevents cross-contamination. So let us wear our gloves. Next, we will raise the lid of the toilet or commode. And then, we will place the bowl of SITZ bath. With drainage port to rear and infusion port in front. This is to provide comfort and safety. And then, next, we will fill the bowl of SITZ bath about halfway full with tepid to warm water. Which is 37 to 46 degrees Celsius. Water at right temperature will relaxes the client and provide comfort. And then next, we will clamp the tubing on the bag, and we will fill the bag with same temperature water as mentioned. And then, we will place or hang the bag above the patient's shoulder height on the IV pole. Okay. So, if the bag hang lower, the rate of flow will not be sufficient and the water may cool quickly. Next, assist the patient to sit on the toilet or commode and provide any extra draping if needed. So, ma'am, come on, I will assist you to sit on the commode. Okay? Be careful, ma'am. 1, 2, 3, let's stand up. Okay. Be careful, ma'am. Okay, 1, 2, 3. Down. And the next, we will insert the tubing into the infusion port of the SITZ bath. So, we will look for the infusion port. Then after we insert the tubing, we will slowly unclamp the tubing to allow the SITZ bath to fill. Okay. If tubing is placed into the SITZ bath before the patient sits on the toilet, the patient may trip over the tubing. And filling the SITZ bath ensures that the tissue is submerged in the water. Next, we will check to see whether there is pressure against the patient's thighs or leg, or if patient's foot do not touch the ground and the weight of the legs is resting on the edge of the tub, a stool should be needed. So ma'am, I will offer you a stool. You can put on your feet on that stool. This may give you more comfort. And then next, it may also necessary to place a towel in the water to support the patient's back in the lumbar region. So, we will use a small towel. Then we will place at the back of it. Next, clamp tubing once the SITZ bath is full and instruct the patient to open the clamp when water becomes full. So, let us clamp the tubing. Ma'am, you may open the clamp if you feel that the water is full. Next, ensure that call bells is within reach and instruct the patient to call if she feels lightheaded or dizzy or has any problem, and also instruct the patient not to try standing without any assistance. So ma'am, here is a call bell. So you can call me whenever you feel dizzy or lightheaded, or if you need anything, ma'am. And please don't try to stand without my assistance. Okay, ma'am? And then next, observe the patient closely for signs of weakness and fatigue. So we will observe the patient. A cold compress may be placed at the back of the neck or forehead. Cool water may produce hypothermia, and patient may become lightheaded due to vasodilation, so cold bell should be within reach. So ma'am, do you need a cold compress? Do you feel dizzy or lightheaded, ma'am? Okay. So if you need me, ma'am, you can use the cold bell to call me. Next, remove gloves and perform hand hygiene. Hand hygiene deters the spread of microorganisms. So ma'am, please excuse me for a while. I'll just wash my hand. If you have a problem or you need anything, just call me, ma'am. Thank you. When patient is finished, put on clean gloves. And then, assist the patient to stand and gently pat the perineal area. So, we need to use gloves to prevent contact with blood and body fluids. And patient may be lightheaded and dizzy due to vasodilation. Patient should not stand alone, and bending over to dry self may cause patient to fall. Ma'am, come on, I will assist you to stand. And I will pat your perineal area tract. Count of 3, 1, 2, 3. Okay, good. Okay. And then I will remove gloves. And assist the patient to bed or chair. Come on, ma'am, I will assist you. 3, okay, be careful, ma'am. 2. Next, ensure that call bell is within reach. And then, discontinue the bath if the patient's condition warrants. So, we will ensure that the call bell is within reach, because if the patient needs our help or has a problem, they can use the call bell to call us. Next, put on gloves, empty and disinfect SITZ bath bowl according to agency policy, because proper equipment disinfection deters the spread of microorganisms. So let us wear our gloves. So we will clean our SITZ bath. And then after that, remove gloves and any additional personal protective equipments if used, and you will perform hand hygiene. So removing personal protective equipments properly reduces the risk for infectious transmission and contamination of other items, and hand hygiene prevents the spread of microorganisms. So ma'am, Excuse me, and I will wash my hands. And the next, assist the patient to her bed, where it is best for her to lie down and out of drafts until normal circulation returns. This is to provide safety and comfort. And then lastly, we will document any findings, patient's response to treatment, and any untoward sign and symptoms. This is to give the patient immediate action and to have baseline. So, we are done demonstrating the SITZ bath. I hope you've learned something about our video for today, and thank you for watching.